If you take medication for allergies, insomnia, anxiety, depression, or even bladder control, you might be surprised to learn that some of these common drugs could be quietly increasing your risk of dementia. Recent research has brought to light a concerning link between certain everyday medications and long-term cognitive decline, including memory loss and even brain shrinkage. These aren't rare or experimental treatments. They are medications found in millions of medicine cabinets around the world. Understanding this risk is crucial, not just for your own health, but for the well-being of your loved ones who may be taking these medications without realizing the potential harm. The class of medications at the center of this concern are called anticholinergics. The name might sound technical, but the way these drugs work is quite straightforward. Anticholinergics block the action of a brain chemical called acetylcholine. Acetylcholine is like the spark plug for your brain. It enables your neurons to communicate effectively, playing a vital role in memory, attention, and even muscle movement. When you take anticholinergic drugs over extended periods, you disrupt this essential communication network, which can lead to memory loss and eventually dementia. It's important to realize just how widespread anticholinergic medications are. Some of the most common examples include first-generation antihistamines, like diphenhydramine, commonly known as Benadryl, and found in many over-the-counter allergy and sleep aids like Tylenol PM and Unisom. Prescription medications for anxiety, such as hydroxyzine, and bladder control drugs like oxybutynin and tolterodine, also act as anticholinergics. Even medications for irritable bowel syndrome and motion sickness patches, such as those containing scopolamine, can have similar effects. The evidence supporting the association between anticholinergic use and dementia risk is robust. A comprehensive meta-analysis published in 2021, which included data from more than 1.5 million individuals, found that both low and high cumulative exposures to anticholinergic drugs were linked to a significantly increased risk of all-cause dementia and Alzheimer's disease. The relationship was dose-dependent, meaning that the more anticholinergic drugs a person used over time, the higher their risk of developing dementia. Another meta-analysis, examining 21 studies, revealed that using anticholinergic medications for just 3 months elevated the risk of dementia by an average of 46% compared to non-users. Even more alarming, studies using advanced brain imaging have demonstrated that regular users of these drugs tend to have greater brain atrophy, meaning their brains actually shrink and show lower brain volumes than those who do not use these medications. These findings go beyond just feeling a little groggy or forgetful. The long-term impact of anticholinergic drugs can fundamentally alter the shape and function of your brain. Why does this happen? The answer lies in the role of acetylcholine in the brain. Acetylcholine binds to specific receptors on neurons, especially muscarinic receptors, facilitating communication between brain cells. These receptors are essential not just for memory and cognition, but also for regulating many functions in the body, from heart rate to digestion. By blocking these receptors, anticholinergic drugs disrupt communication in critical areas of the brain, such as the hippocampus and the cerebral cortex, both of which are essential for memory formation and cognitive processing. Short-term use of anticholinergic drugs can cause symptoms like brain fog, confusion, and slower reaction times. However, with long-term use, the risks become more severe. Prolonged disruption of acetylcholine activity can lead to permanent damage, including persistent memory loss and brain shrinkage. Older adults are particularly vulnerable, as natural levels of acetylcholine decline with age. Adding an anticholinergic drug to the mix can accelerate this decline, increasing the risk of cognitive impairment and dementia. If you or someone you care about is taking these medications, it's important not to panic, but to take action. The first step is to review all the medications you take, both prescription and over-the-counter, and check whether any of them have anticholinergic properties. Don't stop any medication abruptly or make changes without consulting your healthcare provider. Instead, have a conversation with your doctor or pharmacist about the risks and whether there are safer alternatives available, especially if you need to be on the medication long-term. For sleep problems, non-anticholinergic options such as melatonin, chamomile, magnesium, in the right form, or ashwagandha may be helpful. Prescription alternatives like trazodone also have minimal anticholinergic effects and can be effective for sleep in some cases. For allergies, consider second-generation antihistamines like cetirizine, Zyrtec, loratadine, Claritin, or fexofenadine, Allegra, which are less likely to cross into the brain and cause these cognitive side effects. If you are taking medications for bladder control, such as oxybutynin or tolterodine, and ask your doctor about non-anticholinergic alternatives like mirabegron, which works differently and carries less risk to brain health. For irritable bowel syndrome, alternatives such as peppermint oil may be appropriate, depending on your specific symptoms. Your doctor can help tailor safer treatment options to your individual needs. It's also important to consider that the risk increases when multiple anticholinergic medications are used at the same time. For example, someone might take hydroxyzine for anxiety, Benadryl for sleep, and oxybutynin for bladder control, all of which collectively amplify the anticholinergic burden on the brain. This is especially common in older adults, so special care should be taken to minimize overlapping medications in this population. If you've been on these medications for a long time, there's no need to feel hopeless. You can still take steps to protect your brain health, prioritize regular sleep, engage in physical exercise, and address other risk factors for cognitive decline, such as high blood pressure, diabetes, and heart disease. Managing these conditions effectively can help reduce your overall risk of dementia. In summary, while anticholinergic medications can be necessary in some situations, their long-term use, especially in older adults, should be carefully evaluated. The growing body of research highlights the importance of being proactive about your brain health. By staying informed, working with your healthcare provider, and considering safer alternatives when possible, you can take meaningful steps to protect your memory and cognitive function for years to come.